guys, this is Dr. Marcus here at Alvarado Healthcare. Just wanted to do an informative video today on some of the sources of low back pain and explain where your pain may be coming from. So when it comes to spine-related conditions like neck pain or back pain, the four most common sources of pain are the muscles, the nerves, the joints, and the discs. Number one, muscles. Muscle pain presents like a trigger point or a top band. So this is something that you have pain with motions, when you're turning over in bed or when you stand up from a seated position or you bend over to get something. If you're having pain with motion, typically that means there's some muscle involvement. In addition to that, what often comes with muscles, trigger points. So trigger points are tender points within the muscle. Whenever you push them, it tends to be a little painful. Most common places for trigger points are at the nape of the neck, kind of where the neck and the shoulder meet, as well as in the legs or in the hamstrings, calf muscles as well. These are different locations that are very common for trigger points to arise, and those are tender points, and you know that there's some dysfunction there because when you push it, it's painful. So that's muscles. Next is nerve. So nerve, or what's called a radiculopathy, you have pain that travels. So this is pain that typically, that sciatica, that pain traveling down the back, the side, or the front of the leg. So anytime pain travels, it's numbness, it's tingling, it's pins and needles. Oftentimes this is worse with walking. So this type of pain is coming from the nerves, okay? Next is joints. So joints, they help us move. Joint pain it's noticed right next to the spine. So not right down the middle of your back or your neck, but slightly adjacent, slightly off to the left or the right. That can be indicative of joint pain. Also tends to be more painful in extension. So when my head tips back into extension, that tends to provoke joint pain, as well as if you stand up and you lean back, arch your back, behind you or posteriorly, that tends to provoke joint pain. And then the last one is discs. Disc derangement or disc issues. Discs are like jelly donuts or like balloons. What they do is they help disperse forces. And what happens if these discs have too much pressure, you can imagine like a balloon. If you push a balloon too much, it's going to start widening at the sides, and then it could burst. Well, your discs, when they burst, it turns into a bulging or herniated disc, okay? Now with those, patients typically can present with what's called antalgia. So that means they're kind of tilted off to one side or the other, kind of walking a little awkwardly. Disc pain tends to be worse in the morning as opposed to the evening. So if you notice you're getting out of bed first thing and you're having some low back pain, that could be indicative of disc issues. And then also transitioning from a seated to a standing position. So if you notice you go to stand up and it kind of catches and you have some pain there, that could be indicative of disc issues, as well as increased sitting. So if you sit for 5-10 minutes, maybe 20 minutes, and you start to have some pain in the low back, that could be disc derangement or disc bulge, herniation, something like that. Now, I did want to talk about these things because these are all things that we treat in the office. We have different treatments for muscle issues, joint, nerve, or disc. Any one of those that you have issues with, we have great success in this office treating those issues. So if there's any way that we can help, or if you have any questions, please don't hesitate to ask. We're always here to help. Thanks for your time.